Yes, good evening, and how you day? How are you? Welcome. First of all, happy Easter to everyone out there. To the Christians, happy Easter, happy Sunday to you. This now Ask the Doctors program every Sunday, 8 p.m. West African time. We know they joke with our time. My name now Frederick Unubohai, and I did privileged to be the host of this program. How are you? Where you they join me from? And I know say so many people, um, so many people right now they join, they watch me. Where you they watch me from? I see you. Good evening, everybody. Welcome. Today now very very interesting day, and we could talk about one very common topic, and that topic today now back pain. But before I go ahead, tell me for the comment section where you they watch me from. I can see say we get who they here. Yeah, Ngozi Amina, I see you. How are you? And the rest people where they watch me right now, how far? Share the live stream, invite your friends, share, click on the share button. May we start. Make we not waste too much time. Oh yeah, now can you hear me or you know they hear me? Because nobody they respond to me. Why? Oh yeah, let's go. I mean, yeah. Good evening. I can see you. Who they here? Yes, Mma. How are you? Who else they here? Happy Easter. I'm watching from Ireland. Dave, I see you. Hey, Mr. Alex. Good evening. Happy Easter. Tina. Good evening. Happy Easter. Mr. Alex, how are you? How you day? Where you day? You day work at the house. Good evening, everybody. Tell me where you're watching me from. I have been waiting for the topic. I can hear you. Yes, we can hear you. Very good. Good evening, everybody. Good evening. Good evening. So today's topic, how many of us don't get back pain before? Me, I don't get back pain before, and I know how it be. Say most times when you don't get some problems, you go feel really understand what people they go through. Because when I dey prepare for this program today, I did a lot of research. If I tell you what I see, hmm, Mercy is watching us from UK. I see Amarachi from Abuja, Agbesi. Yeah, good evening, welcome. I'm watching from my bedroom. Okay. Don't ask us any questions that is not related to today's topic. Do you understand? Now, back pain we won't talk about. So, how many people don't get back pain before? You don't get back pain before? Yes, I've had back pain before, and it's not funny. Now, it is very common. Most times, people they go hospitals because of back pain. Some don't go, they don't tire because no solution for them. But today, I say make we just break them down. Make we talk about back pain, waiting they cause them, the brief symptoms. Again, anything where you feel do. Yeah, I don't get back pain even till now. Yeah. Oh, I see. I have had back pain before. Wow, a lot of us don't get back pain. So make we start this evening. Let's start quickly without wasting time. Do not forget if you dare, Jeremiah, I see you. Ngozi, I see you. Love it, I see you. Wait, let's talk first. Let's talk first. Let's talk first. Then we'll take questions on back pain. Now, for you to feel understand what in back pain be, I need to show you something. Are you ready? So, ma show you something for everybody for your screen. If you can see my screen, just tell me yes, I can see your screen. Yeah, let's go. I don't share the screen for you. Very important. I want you to see. Yes, can you see my screen? Very important. Waiting dey my screen right now. This thing waiting my screen. Now say every human being where they listen to me. This be like your back. Now Google now you open. I no get time to prepare for this thing because I dey busy. If not, I will take my time. But I open Google and I want to show you something. Now, what I want to show you be say, look at this picture here. You see this bone? Good. This is your spinal cord, that bone ready for the back, from your neck down to the region of your waist. This is the bone. Now, this bone, they very important. It dey help you if you stand like human being, if you waka, it dey protect you, give you support. Now, for this bone, we get muscles. Can you see the muscles around? You see this one ready for the shoulder here? Can you see the muscles? They work together. I know they see your comment. Oh, tell me, yes, I they see your screen. Yes, I can see. Very good. Yes, I can see. Very good. Now, you see the muscles there. You see the bone, Abi. Very good. Now, inside the bone, around the bone, you get what we they call ligaments. So, I want to open another picture again. Make I show you now. Ligaments. What be ligaments? Ligaments now things where they join your bone for the back to another bone. Do you understand? Ligaments now things where they join your bone for your back to another bone. Very good. So I want to show you another thing for my screen. Good. So that you will understand very well. Number one, you have bone for your back. For your back, you get muscles, Abi. Very good. Now let me show you something that we call uh, ligaments. Oh yeah, I made this one no disgrace himself. Oh, he done the hook. Hey, voila. Oh boy. Okay, let's do this. Yes, it's gonna show right now. Very good. So I'm showing you all what we call ligaments on the screen. These things what I want to show you, they're important so that everybody will feel understand about back pain. You look very carefully on my screen right now. You see these things, you see these bones. These are like the bones in your back. You see these things here, the bone. Eh? Then we get ligaments. Ligaments, they join each bone to one another. You see them? They join bone to another, one bone to another. Now, for this bone where they up and this bone where they down, if you look in between, there is something there. If you look in between the bone above and the bone below, there is something in between. Look at this one here. The one above, the one below, there is something in between. See, I'm here. It there for everybody back. It there for your back, for these your bones. It did there. Those things, we they call them disc, intervertebral disc. It be like shock absorber. They hear me so? It be like shock absorber. So when one bone they up and that bone they shock absorber they in between, intervertebral disc. So for all this bone, for all the bone where I show you before, for this first page, all the bones where they there, you have things like you have things, yes, they show right now. From one bone to another bone, you get what we they call intervertebral disc shock absorber. So all the bone where they from your neck down to your waist region, all these bones get shock absorber, intervertebral disc. Now, for this bone too, you still get what they call nerve. The nerve. Yeah, the nerve. Make sure not forget to send stars. Oh, you can send me stars on this live stream. Don't forget to send. Sorry, somebody chat me. Oh my god, no vex, huh? Okay, good. Now we get shock absorbers. These things are very important, meaning that if you get back pain from the bone, see these bones, you can have back pain from your bone. You can have back pain from your muscle. You can have back pain from those shock absorbers if they come out for where they're supposed to. If you get back pain from the nerve, so make I find another picture again. And I don't understand. You they follow me at all, or they follow. May I know whether we did together. I'm taking my time to break this down because this topic they're very important to almost everybody. So make I find another thing. May I show you what I mean by nerve. Mm-hmm. They carry information. Okay, I don't see one. Let me see. Yeah, if this one go fit clear for your eye. Okay, let's see. Yes, I'm following you well. Very good. Uh, Dr. Israel, Alpha.
I'm fine, though. How we doing?
Fine. If always make I accept you in, your live stream no go show for your side, though.
You
Okay,
said?
good evening, everybody. No, I said you for wait make I bring you up. your own live stream no go stream to your side. May I check whether you dey show for your side? Let me check.
Don't worry. And they don't tell me say wait. They've sent me that I went to setting. I saw a place where I can stream it to my own audience.
Oh yeah, do I dey look out for your Facebook live right now. Do I dey look out. So Dr. Israel, good evening, welcome. So we dey talk about back pain, and I dey talk about the anatomy of the back. So I don't tell us about the bone for the back, the bones. I don't talk about the muscles for the back. I don't talk about the intervertebral disc. I don't show you picture. Then I dey show you about the nerves. Now the nerve, they carry information from all your body, go your brain, back to your spinal cord. So if you get problem for the bone, you get problem for the muscle, you get problem for the intervertebral disc, the shock absorbers, or you get problem for the nerve, or you get problem for the ligaments where they join one bone together, you fit get back pain. It makes sense. Very good. Very, very good. So Dr. Israel, can you hear me?
Yes, I can hear you.
Okay, good. Welcome everybody. Good life in a sense. So right now, when we go to the risk factors, wetin be those things wey fit make person get back pain? I've spoken about the introductory parts. Everybody, I told you about the bones in your back. Remember, if you didn't see it, let me show you again. Very, very important. If you don't understand this, you will not understand back pain at all. So don't ask us any question yet, I beg. We are after a while, I will tell you to ask questions. Listen, don't ask questions, I beg, so that you don't distract me. See your back. See your bones for the back. This one's dey the neck. This one's dey the thorax. This one dey the waist region, lumbar region. Then you get muscles. See the muscles here. And then you get ligaments. All of them, they function to help you. So if you get problem for the bone, or you get problem for the muscle, or you get problem for the nerve, or you get problem for the disc, or you get problem for the ligaments, you fit get back pain. So Dr. Israel, over to you. Over to you. Let's talk about the risk factors. Wetin be those things wey fit make somebody get back pain?
Okay, there are some risk factors when fit make people get back pain. I know Dr. Fred don't talk so many things about the back itself and some other things. So I will just talk give us some risk factors, and so that we can actually continue. And one of the risk factor is age. As people grow older, they are more likely to get back pain. So within the age of from 30 to 40, as they go, back pain, they fit get back pain. Now, people when not they do exercise most of the time, and that is lack of exercise. These people are still also the physical get back pain, because this time they know they exercise the muscles of the back, and sometimes the muscle fit on they stiffen, and that could feel lead to back pain as well. People with excessive weight, people will get weight too much, and they talk about those when they fat that are obese. Those people will get too many weight, when they say their bone, their spinal cord and even their hip bone not the fit carry them well. All those people physically get waist back pain. Okay, as they talk, diseases. Some diseases physically cause back pain. Example like arthritis, some cancers, mostly for men. Prostate cancer fit affect the low back. For women, some of them when they get infections, some of them see they get low back pain. However, arthritis mainly and cancer, they contribute well to low back pain, and those ones they affect the bones in particular. improper lifting of objects. And when you dey lift a lot of objects, and some people physically get low back pain. Sorry, get back pain. Might not say low back pain. They go physically get back pain. Improper positioning. Where you dey sleep, your bed. When you dey sleep, when you see some people for their bed, as they lie down for their bed, they'll be like say they enter inside the bed. And so that's improper positioning during sleeping and all that. All those are physical cause back pain. Psychological condition, physical back pain, where people that are prone to depression, anxiety, all those ones, they fit get back pain. Sometimes the pain fit not dey there, but their mind go just dey think say they get pain. And also they can also, because of their depression, they may not want to do some exercise, they may not want to do anything, so it will lead to muscle tension, and so the muscle will dey tense, and that can also lead to back pain. Also, smoking can also lead to back pain. It dey increase the rate of back pain, and because through smoking, people can get problem to their bones, thereby leading to high risk of osteoporosis. Weakness of the bone go fit come to play during smoking. So these are some of the risk factors when go fit make people get back pain. When go fit make people get back pain. Thank you, Fred.
Thank you very much, Dr. Israel. If you just come, welcome. We talk about back pain today, and we don't talk about the bones for the back and other things. Dr. Israel don't talk about those basic things, common things where they cause back pain. Before we continue, I won't beg you, I beg. We get about 60 people for this live stream. Everybody, wherever you watch me, whether on Facebook or YouTube, I beg, share this live stream. Click on the share button. That is how you support us. I beg, share. Then if you want to send stars on Facebook or YouTube, you can send stars. Thank you. Now, because Israel don't tell us, say, as you increase for age, if you get back pain. But get one thing where we talk right now, and that is the causes. Like, let's say, if this one happened, there's a very high tendency, say, you go get back pain. One interesting thing where I like where Dr. Israel mentioned, now mental conditions. Some people no get anything where they cause them back pain. But because of their mental states, they get back pain. Now, if you get questions for us, relax, I beg. We go take your questions when we don't almost finish our discussion, so that everybody can understand. Some kind of infections like kidney infections, kidney stones too, they give you back pain. Or say you get fracture, you fall, you climb ladder, you fall, if you get back pain. One very important thing where I for like talk, as I go hand over to Dr. Israel again, now with regarding the disc. Some people, remember I said we talk about the disc, shock absorbers, between one bone and another bone, that disc. For some people, that disc feel push, come out. Maybe you dey overweight, or you carry excessive load for work. You get how you do one kind of very bad posture. You feel give your disc problem. That disc fit shift. Now, make I show you a picture as I hand over to Dr. Israel again of when the disc of somebody back shifts, so that as we dey talk, you go fit get a clear picture of wetin I dey try paint for here. Now, I believe everybody they see my screen, Abi. We can all see this screen. If you look here, this one at the bone, this blue stuff here, now the disc. For some people, the disc for their back fit shifts. And when it shifts, it don't come off for where it's supposed they give them pain. Remember, they get nerve. Look at all these pictures here. The disc don't come out from where it's supposed they. See this one? It don't move. I just want to list one stuff which will cause you back pain. Then Dr. Israel mentioned, which in again, talk about osteoporosis, talk about fracture, then the kind of lifestyle. Yes, if you dey smoke, so you know say smoking too, they weaken your ligaments. Smoking, they weaken all those ligaments where they support your bones together, one bone to another. As they smoke, they weaken them. Or say you sit down for office. Yes, very important. You sit down for office, and as you sit down for office for a very long time, we notice say if it give you back pain because of that posture. You don't put too much load on the things around. Now we get two types of back pain. We get the acute one and the chronic back pain. Maybe I'll allow Dr. Israel to talk to us about that. Then we'll go enter the symptoms of back pain. Dr. Israel, over to you, sir.
Okay, and I'm still going. I still there on the causes of back pain, Shay.
Yes. Then we'll enter the acute, chronic types of back pain, then
because
symptoms. Yes.
because because the one we first talk now the risk factors, so things where if it cause back, where if it make these causes come to play. Now,
correct.
One of the causes of back pain are muscle or ligament strand.
Correct.
And when we say the muscle or the ligament when they our body, the muscles where they the back, they don't overwork, they will come stretch, or some of them will come break. And let me use the word break or tear. So those one fit cause back pain. And how those until they happen is for people where they carry, where they lift heavy things, where they lift weight. Now make if you see people, all those weight lifter, they always tie something for their waist, something like big bets, they tie their back and somehow. This are not to prevent that all this muscle from tearing. So because they know say if it tear, it could lead to back pain. So those kind of people if get muscle spasming, and which can lead to back pain. People where they sit down too much for one place, as Dr. Fred talk, and they lead to that one as well. So for that, most of the time for people where they sit down, a different way you sit down, you will not get back pain. And the way you sit down when all those pain fits come to play. Now Dr. Fred already talked about ruptured discs, and ruptured discs or bulging discs. So that one are the thing where they soften the way it be like shock observer. As Dr. Fred talk, when it be like shock observer, sometimes some of it feel pull off for where it's supposed to be. And when it pull off, that thing can cause acute pain. The pain, that one they very painful. And so that is an example of an acute pain. Now, accident, as we earlier said, accident can also lead to pain, and all those ones, some of them are acute pain. We often talk of arthritis and different type of arthritis, osteoarthritis, and the others ones will feel lead to pain. Now we say we get chronic back pain and acute back pain. I don't give now one example of acute back pain. Accident can lead to acute back pain. Also, that slip disc can lead to acute back pain. Now, when we talk about chronic back pain, for people who don't take injection, no people who do surgery, where they give injection for the back, some of them if you can't get pain later. And some of them, not be everybody, you not say doctors everybody, no, not be everybody. Some of them, and some of this pain fit become chronic. It go there for long. Now, people will still get some diseases like cancer, and some of them fit get chronic back pain. Now, even this muscle and ligament injury and fit still cause some people chronic back pain. It means it because sometimes because we know the weight make the pain heal, some of us go continue to do the work when we do continuously, and this pain will remain there. And some of us not go want stay try to see how we go take prevent it. And if we not prevent this pain, some of the time they remain there. So sometimes when the muscle is stiff and it has been stiff for a longer time, it can also lead to this kind of pain. And these are chronic pain. And most of the time, most chronic pain are due to some other causes, some other infection where the injury or problem where the body will lead to the pain. So even as we say accident can cause acute back pain, it can also cause chronic back pain. So even after some surgery, for some people will get problem with their hip bones and all that, and their hip joints, and they do some surgery and all that. After some while, they may not be having pain for some time, but later they can start having back pain. Arthritis can also cause chronic back pain. Arthritis can cause chronic back pain. Okay, so when we say chronic back pain, this is an back pain when they were person for a very long time. Even when you take, the only thing that to just take some drug to reduce the pain for some time, but is there for a very long time. Even the sleep disc, if it's not treated or it's not handled on time, can also remain chronic. Can also remain chronic. Okay, Dr. Fred.
Yes. Thank you, Dr. Israel. Welcome for those who just join us. Now, back pain we dey talk about. We don't talk about how the back be for everybody. We don't talk about the things which cause back pain. Dr. Israel don't talk about the acute causes of back pain, the types of back pain, acute and chronic. Now, more talk about the symptoms. You know, people believe, say, back pain. Basically, they could just tell you, say, my back, they pain me. But people don't really understand, say, even as you dey feel pain for your back, you fit get some other symptoms. Example, this pain fit even enter your leg. Where we say the person to come move, go even wan come dey hard the person. I don't know if you understand. Person, if you don't get back pain, you go understand. Now, based on wetin we talk in the beginning, different things fit cause different types of back pain, and different types of back pain fit give you different types of severe or small symptoms. For some people, the back go just tight them, while for some other people be say to waka go hard. For every time you move, you feel pain. For some other people, to even stand straight go be problem for them. I don't know whether Dr. Israel get any other symptom again for those we get. Remember, say things like kidney stone fit cause back pain. Things like cancer fit cause back pain. So if somebody get cancer now, other symptoms wey you fit see na like weight loss, person fit dey lose weight, person fit dey tired, the person fit no like to dey chop. Do you understand? So depending on the causes of the back pain, you fit get some other symptoms. I don't know if Dr. Israel get any other thing to add again. Then we go talk about how they take diagnose back pain. Then we go take on our questions.
Okay. Now, other things when person fit notice during this back pain. Sometimes they depends on how the pain be. Some people feel they notice say the pain they be like say they pepper them. They pepper them somehow. Sometimes it feel be like say something they hit you for there, boom, 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 boom for the back. These are not some things where people go feel express. Some feel you notice say the pain you're in one place, you know they move go any other place. As Dr. Fred talks, say sometimes the pain feel move go their leg side. But some people if you pain go your feet there, you know they move go any place. Some people when they notice say move go their leg side, you'll be like say they shock them. And like say electric shock they there. And as Dr. Fred say, some people go feel like say the waist, the back side, they tight. And those are the one we say muscle they stiff. They tight. So these are some things when person go feel. Now I remember we thought say as Dr. Fred thought kidney stone can cause it, and I also tell you that for women infection can also cause it. So some of the time they can have all those things symptoms. So sometimes when we see women they complain say they get low back pain, and now you should also know that the pain fit get in your position. Some pain fit the upper part, some pain fit the lower part of the back. And most of the time, this back pain they along the spine area, where would they call spinal cord, along those spine area. Most of the time, and the pain they. And sometimes if people are saying that the waist, then those are not be the low back pain. Those are when people are saying that the waist they and upper part of the waist they lead you. So most of the time, some women they come with those kind of pain, and some of them they can be infection and all that. So you also want to find that if they get discharge, if they get anything. Some fit come with fever for mostly all those arthritis, arthritis, osteoarthritis, all those ones fit come with fever. Some people fit not fit eat and all that. So as Dr. Fred earlier said, each each pain or each symptom each back pain follow other symptoms wey fit follow them, fit be due to other things wey cause the back pain, other things wey cause the back pain. For those wey get cancer, mostly for the men wey get maybe prostate cancer, you fit notice say dem no dey piss well. Even for the kidney stone, if dem wan piss, dem dey get pain. For the infections too, if dem wan piss, some of them go dey get pain as well. So these are some things. Or you see blood for urine. For fracture, you may see that dem no dey fit move their leg, or sometimes you notice say one leg fit long pass one. Just like that. These are some symptoms that these people can present with. But one of the most important symptoms when they present with na be wetin we just call pain. All of them, they come with pain, and they get pain for that back, most of the time. So if it be up, if it be down. And when we talk about how the pain they be, some people feel say the pain they look like say pepper they there. Some people say the pain be like say there they hit the boom boom boom. Some like say somebody they hit the place. Some people say the pain just they sharp. Some people say the pain they dull, and it they present throughout the day. Yes, from morning to night, the pain just they there. Okay, Dr. Fred. The next thing we want to talk now,
Yes.
waiting again.
We go enter the treatment.
Okay, how to diagnose?
No, diagnose, yes. But before we talk about diagnosis, I beg, make I show one thing. You remember, say you mentioned age and back pain. Age, for those who won't really understand, I won't add one picture quickly, then we'll talk about how to diagnose. Now, if you look at this picture where they show for your screen, everybody, you see, wetin age they cause. As people they increase for age, normally your body go dey change. One of these changes fit affect you for your back. If you look your spine, you see this disc here, wetin we dey call our like shock absorber, normal. But when somebody they age, they increase in age, this disc fit dey reduce, they degenerate. That is the word we use medically. It go dey degenerate, or even the bone fit dey degenerate. I don't know if you understand. So when the bone they degenerate like this, if you can they give the person waiting, if you can they give the person pain. Now, if you look, shall you see, as the thing don't they degenerate, they go so. You go come they press the nerve where they around that bone area. I'm just putting this picture here so that make we feel understand. Like say we go they imagine for our brain. So you see the nerve now, this thing way yellow. Now they carry information from your back everywhere, go your brain, come back. But when the disc can reduce, the bone will come they touch the nerve, will come they give you pain. That one now one of the things where age they cause among every other things where they cause you back pain. It makes sense. Very good. So Dr. Israel, more we talk about how to diagnose back pain. First of all, make I start, then I go hand over the mic to Dr. Israel. Please, ladies and gentlemen, make una share. People are not sharing this live stream. People are not sharing. People are not even sending us stars or this. Support us by sharing and liking. Thank you. The first one, for you to be diagnosed back pain, you need to follow your doctor discuss, what we call history. That is, your doctor will follow you talk about your symptom, how it starts. Go ask you wetin you dey do, the kind job where you dey do. Go ask you your lifestyle. Go ask you many things. These questions where they ask you, not be because say doctor like to they ask questions. Now because say we want to know where the most likely cause of this pain. The doctor they use in brain to find out. Go ask you your age. Go ask you your family. Go ask you whether you dey chop well or you dey lose weight. Go ask whether you get fever. go ask you whether you dey smoke. If you understand wetin we don talk from the beginning, you go know why they ask you. Then after e don ask you finish, your doctor go come examine you, go come tell you say, "Oh yeah, lie down, move your leg, do this and this and that." Dr. Israel, over to you, sir.
Okay, all wetin Dr. Fred dey talk na that one we dey call clerking and examination. That na wetin the doctor go first do. So now when the doctor do that one, you can't know which type of test he go tell you make you do. So when you be say some people not go first go meet doctor, make doctor do those ones, but go your wrong, go do test. It go make some of you spend a lot of money and go make una spend more than what una supposed spend. So first thing, when you meet your doctor, he don't click you, he don't ask you all the question, how your pain they be and all that. He go do examination, try to check with the back, say one or two things about the back. After that, then he'll come send you, may you go do some investigation. One of the investigation when he go fit send you to do now back X-ray, X-ray, and the one see the back bones, the one see how the bones for the back be. So they go fit tell you may you do X-ray. Another thing when they go fit tell you may you do now CT scan. That one they expensive, but it will really show if there's a slip disc, if there's, it will really give a good picture of anything when they happen between the spine, between the spine. And MRI also now another thing when they go fit say may you do. Remember, say we tell you say not be only other thing fit dey wey dey cause the back pain. So the doctor fit tell you may you do some blood test. This blood test we can reveal which other things they cause, which other problem you get when they actually lead to the back pain. Which other problem you get when they all actually lead to the back pain. Sometimes they fit do some, this one a very advanced one. If the nerves, they notice that the nerves get issue, they fit do some nerve studies. Still try to see wetin dey happen to the nerves, where the nerve are compressed, wetin compressor, so that make them know how to fit relieve that compression, and so that make the person fit dey okay. So even your X-ray, your CT scan, your MRI, fit even still show them those ones. I wish they go fit help to make sure say they give you the best treatment, and also make them know wetin they need to do for you, and the kind of drug or the if na physical exam, if na physical treatment where you not need drug, or they don't need to tell you say see wetin you need to do and wetin you need to run for. They go just still tell you. If not the one where you go, they go give you medication, they go just still give you. If not the one where be say na surgery you need to do, they go also come tell you may you foresee do the surgery.
Oh,
Okay, Dr.
okay.
Fred,
Thank you very.
over to you.
Yes, thank you very much. Now we go soon take questions. We go take questions. So if you get questions, start to dey drop your questions. But once again, ladies and gentlemen, if you know they share this live stream, you know they support us now. Share. Some people never even send us star or like. Please share by supporting. So we want to take your questions very soon. The next part we want to talk about quickly before question and answer now. Treatment. How did they treat back pain? I get back pain. Wetin make I do for my back pain? So man, I'll start again, then I go hand over to Dr. Israel. Now, very, very important. The treatment of your back pain. Now, when you know wetin dey cause your back pain. So if your back pain dey caused by the kind job where you dey do, maybe you dey sit down for too long and you dey get back pain. The best advice wey they go give you now say, no, they sit down for too long. I don't know if you understand. Let's say your back pain now kidney stone because your back pain. The best treatment now, make we address the kidney stone. If we address the kidney stone, the back pain will disappear, right? Or maybe your back pain are due to mental issues. Maybe you get depression, anxiety. If you correct those mental challenges, most times the back pain will go. If your back pain now due to muscle strain or muscle sprain, they will tell you, say, okay, make we massage and give you medication. So the type of treatment for your back pain now basically based on waiting they cause your back pain. Sure, it makes sense. So Dr. Israel, over to you as we start taking questions soon.
Okay. Dr. Fred already talked. It depends on what they cause your back pain. Neither go fit treat your back pain. So most of the time, the underlying cause neither will they always want treat. Once you treat the underlying cause, some of this back pain will come out. Some of this back pain will come out. So we can either treat them using medication and to see how to remove this back pain, or we can also use physical method. Now try to teach you what you need to do, so that this back pain go rest, go relieve you. Also, when we say physical method, we say they talk about physiotherapists and all that. Sometimes you'll be forced to do some exercise, some small exercise to make sure say the muscles for your back they flexible enough. Because you know when muscle they tight and all that, as we earlier said, it easily lead to that back pain. But when the muscle don't they flexible, it can actually relieve the pain. So also your sitting position can also be changed. And this is a physical method to actually treat you. So with these things, you may not need medication. It's just for you to make sure that you are able to do the right things. And when you are able to do those right things, all those pains will come out. Then for the medication part, someday when we say they're not going to give you maybe you drink, it will feel you'll be waiting, you go rub for your back, so that made the pain go. Then when we still talk about physiotherapists, the physiotherapist will use some kind of fluorescent light for your back so that the pain will go. So in some cases when we say there's compression of the nerves, and you may want to do some surgical procedure to relieve the nerves, so that those pain will also come out. And there are different procedures. There are different nerve surgical procedures that can be done. So not be that one we want to talk about, but just know that yes, there are some surgical procedures that can be done. There are some medications that you can take, and sometimes it may not be tablets you go swallow. It can just be waiting they go use to rub your back. And three, there are also some physical things that you need to do. Physiotherapists can help on that, and apart from physiotherapists, even yourself, you can help on that. Your sitting position, you need to change. If you be person where they sit down, don't rest your back anyhow. You need to sit down straight with your back so that your back would shift, go inside. Where that one still help to reduce the back pain. If you they lie down for bed when people say they once you enter, you go inside. You need to change your bed. And when you lie down for bed, when people say you go just stay on top, it will still help to stretch your back. And when the back is being stretched, those pain can also be relieved. So those are some treatment methods that can be used in terms of treating back pain. Dr. Fred.
Thank you so much, Dr. Israel. Now, if you get questions, we get about 78 people where they listen to us right now on Facebook and YouTube. If you get questions, I beg on this topic, back pain, please, if you drop your questions and then we go take your questions. So we get some comments here. Make I just try go up. Let's see. If your question is no day related to the topic, no vex.
Dr. Fred, as Dr. Fred they try go up, I feel just run a little on the prevention. Now, to prevent back pain, we need to do exercise. As I earlier said, exercise will make your muscle they flexible. And if your muscle they flexible and gain more strength on your muscle, and most of this back pain will be reduced. Also, we need to maintain a healthy weight. You know, we thought say if person get if person dey obese or he weighs too much, it can lead to back pain because the body not fit carry everything when you get, so it can lead to back pain. So person need to maintain a healthy weight so that it not go get back pain. Another thing, you know, we say smoking can lead to osteoporosis, that is weakening of the bones. So quitting smoking can also help to reduce back pain. So another thing we say, sitting smart, and to sit smart can help to reduce back pain, and you must not lift everything when you see for this life. So know where your strength reach in terms of those when they lift weight. And if you must lift weight, there are some things that you must use to cushion your muscles, so that make them not tear and make them not spoil. So those are some things you can use to prevent back pain.
Okay, we get questions here. Mo will take on a question sharp for the next 10 minutes and then we are done. Dave, carry on. They ask us questions. Say, I have to. Okay. One, can taking so much, that should be Ciprotab, cause back pain? Taking up to 3 to 4 packets of Ciprotab. And then number 2 is, does taking Panadol extra cure back pain? I'll start with your number 2 first. Before I go to number 1, it shows say you don't really understand what we talk. The management of your back pain, now when you know what they cause them. So if your back pain is caused by compression, the bone they press, no matter the Panadol extra you will drink on this planet, never go cure, because something is pressing the nerve. But if your back pain is caused by poor posture, poor sitting posture, or you sit for too long, we go tell you, say, do not sit for too long, get up. But if you always drink Panadol and you sit down for too long, the pain will continue. So the management of your back pain are based on what they cause them. Yes, the Panadol fit relieve your pain transiently for few minutes or hours. But if what they cause the pain are compression or slip disc or stone, your pain go there. And then for the Ciprotab, I'll just take them quickly. So I'll ask also usually talk about the second question. For Ciprotab, number 1 is this. We always talk for this program. No doctor will give you 4 packets of Ciprotab. So most likely, maybe now they take them on your own, which is a very bad stuff. We know they encourage anybody to self-medicate. Always speak with your doctor. So no medical doctor will prescribe Ciprotab more than 2 packets. Even 1 packet is enough for you. So maybe now they take them by yourself. Now, medications get side effects. Ciprotab is called ciprofloxacin, levofloxacin, or floxacin. In very rare cases, it gets side effects. It affects the nerve. Ciprotab, levofloxacin, or floxacin fit damage nerve. So we tell people, say, take medications as prescribed by your doctor. However, these medications get their side effects. A very rare side effect of this group of medication, we say, if it give you problem with your nerve, tingling sensation, pain, or permanent nerve damage, which will affect you for your leg or any part of your body. Is that okay? So, Dr. Israel, the next question, quickly. This one says, can ulcer cause back pain?
So, friend, I don't hear you clearly.
This can ulcer cause back pain.
Okay, that one, okay, that ulcer, yes. Let me just say yes. When would they talk about PUD? It's a referred pain. It's a referred pain to the back. Actually, the real pain, then the epigastric region of the stomach. But because your esophagus they close to the back, so that pain be like waiting they refer. You'll be like say you they feel the pain for your back. So that's what we call referred pain. So most of the time, taking Panadol not go cure this kind of back pain. Now for you to treat the ulcer. So when the ulcer is treated, this back pain when we talk about will also be cured or will be treated and will be treated, because actually pain not really there. Now referred pain. It just they go there because of the nerve supply and all that. So now make the pain go dey show itself for there. But the real pain, where the real pain dey, na the epigastric region, for your belly, may I call am belly or abdomen, for your abdomen, the epigastric region. Now there the pain really dey. But the nerve supply, because e still get something to do with the back, so e go throw the pain still go the back. So people go see dey feel say pain dey the back. Na make most of the time when you come hospital and you say you get pain for belly, upper part, the epigastric region, the next place wey we dey try to act, now you dey see the pain dey reach your back. Wetin we dey try dey ask, e dey refer, e dey radiate to your back, like the pain dey go your back. Some people go say yes, and that means say yes, yes, it fit be ulcer, and it fit be any other thing, but na because of that nerve supply na be cause now.
Thank you very much. Wait first, make we thank somebody. Somebody just sent stars. Dave, carry on. Thank you. I just received the stars. If you send star, you can put a comment so that I can pin your comments. Dave, carry on, Charlitan. Thank you for the stars you sent. I saw it. The rest of us, you can send stars. God bless you. Okay, let's take this question here. Ma, take it quickly. It says, can back pain cause paralysis? Can back pain, this thing where you ask us, I go say yes, but this yes, maybe my other doctor here go throw more lights, or maybe go agree or disagree with me. Yes, if remember paralysis, we get what they call total paralysis and one part paralysis, you understand? But that will be in the extreme case, no be immediately. For back pain to cause back pain to cause paralysis, it means say something don't press your nerve. The nerve where they make you feel waka, move your leg. Something don't press them. The nerve no feel work again. And that back pain, until proven otherwise, you know if you sit down for house with that kind of a back pain, you go run go hospital. So yes, but now in the extreme case, nobody say you go just sit down, you don't get back pain, you know if you work, unless maybe an accident happen or person fall, just twist the spine, the back like that. But basically, back pain go feel waka, you go feel move small. But any back pain will go make you no feel move, go give paralysis. That back pain be say something they press your spinal cord, and if you don't they there gradually you they ignore them. I don't know if Dr. Israel get anything to add to that.
Dr. Fred, you don't talk am. Now say actually be for back pain to cause paralysis, you know, say one, that back pain don't dey there for a very long time. For some people, why for some people it fit just be accident. Or when we say accident, not be only road accident too. Person fall from height. Now
From
accident.
ladder.
Person block hit am for back, trauma, na accident. So if anything cause a fracture or serious fracture for the spinal cord, when we say it can affect the spinal cord itself, because now from the spinal cord, all those nerves from the command can affect the spinal cord itself, it will lead to paralysis. It will lead to paralysis.
Yes.
And for some people, when get that, when we say back pain, we don't dey for longer time. You don't say, but those one we don't get back pain, we don't dey for longer time. They go don't feel the complaint of say that they feel shock, their leg they shock them. Their leg sometimes if they even stand, their leg they shake for ground. They know they fit stand where because of the pain with their back, and the pain for their back they move go their leg all the time. So those kind of persons, majority of them, in long term, later, they feel come get leg paralysis. That they feel not feel waka with their leg. However, when these things are taken care of, for those ones, they feel come back.
Thank you, Dr. Israel. So many comments here. If you know they share, please support us. Share the live stream. Support us. You can send stars, just like Dave did. Thank you. Now we have a question here. We'll make them very fast. Can drinking a lot of sweet drinks cause or increase back pain? Dr. Israel, you want to attempt this?
I know say this person want try go talk about jedi. Yes, that this person don't run they go now. He want talk about jedi. Now, what I want to say on this ground is that when you take too much, we know say too much of everything they say is bad. So anything will go make you can't get dysentery, or yes, dysentery, because that one physically cause some kind of back pain and can lead to back pain. So if anything will make you get any problem with movement of bowel, can lead to back pain. So I will not want to just say sweet drink, because some people feel drink like 120 bottles, they not get nothing will happen to them. So it depends on the individual. It depends on the individual. So what I would want to say is, if anything they when if it prevent your good bowel movement, or if it cause you dysentery, because those ones will give you some kind of back pain. So you need to avoid them. You need to avoid them.
Okay, thank you. We get another one. Please, doctor, I'm having upper back pain and chest pain for some months now. Please, what is the cause and what can I do to stop the pain? I don't understand what you mean by, madam or sir, your name is Lovett Udoka. I don't know if you follow us. If you follow us very well, we always talk something here. Say, this place now to educate you only. We know, I don't fit tell you, I don't know, I don't fit tell you what they cause your back pain or what they cause your chest pain. Neither can I even tell you so what you go do. Do you understand? We always make this thing clear that please speak with your doctor. If you follow us in the beginning, we tell you, say, they go follow you talk, they go examine you, they go do tests for you if necessary, and then they go treat you. We can never treat you on this platform. Here, now information we don't give you. And we believe say information is power. No vex. We can't manage you. I can't tell you to go and take any medication. I don't want to lose my license. Do you get? No vex. Please speak with your doctor. We listed so many causes of back pain. Also, chest pain gets so many causes. I don't know if your chest pain are the same thing with your back pain or not two different things. So I beg, no vex. See your doctor, make them check you. Pastor Israel, anything to add? We'll go to the next one.
No, go to the next question.
Okay, please attend my question. The pain on my lower back is too much. We can't see your question. Sorry. There is one of my friend that is doing mechanic. Okay, he told me that he's having back pain. That sometimes if he wakes up in the morning, he noticed that place is paining him small. Also, Israel, what do you want to tell this person?
Okay, this kind of person and the kind of person when we put join those people where they lift everything. Is a mechanic, so they lift a lot of things. And most of the time they bend down well all the time. So his posture and what they lift will be the cause of a back pain. So what you will advise is that you should look for a way to reduce those lifting of things. There's some machine you can use to lift things. And you should also look for a way to build this mechanic in a way where it not go they bend down too much. I don't say they get they take the dig hole for your mechanic now. When they say the person they'll build down under, the motor go there, the person go there under. So in that case, the person may not be bending too much. And also it doesn't mean that because it's not bending too much, it should not be standing too much. Because all of them physically cause waist pain. So if he has done some work to some extent, you need to take break. You need to take break. So when you don't repair motor reach one place, you must not over repair and finish once. When you don't repair motor reach one place, so when you notice say your body don't get one kind, take a break, take a little walk, relax more. Then you can now go back to continue the work when you do. With it, it's just your lifestyle. The person just need to change his lifestyle a little. Then also you need to see his doctor. When you see the doctor can prescribe 1 or 2 medication or 1 or 2 things for him to use. But first thing first, the best way to treat this is back pain is to modify a lifestyle. Also, which kind of bed did they sleep put? If the bed are the one when they press and go inside, like that you go inside, you go still get back pain. So you need to get a mattress when we call it orthopedic bed. If you not get orthopedic bed, at least semi-orthopedic is also better. So that the patient feel day on top. I say patient, sorry, not be patient. The person feel day on top, it not go press go inside. I think that's how I will answer this question.
Thank you, Dr. Israel. Also, if they do massage, as they rest the back, make it massage so that it go release the tension where they in back muscle.
The
Do you
tension
understand?
for the back. Yes.
Ngozi,
Yes.
Ngozi, thank you very much. Ngozi sent 50 stars. I just saw it. Thank you. And then who is this? Patrick. Patrick, why is it? Omo, thank you so much. God will bless you guys. We'll go use this one for subscription of this platform. Thank you very much. Okay, we get so many questions and we are almost out of time. Thank you so much. We are almost out of time. God. Okay, this one says, my back pain is one side of my back. And when they did x-ray, they told me to go and buy medical mattress. Is the mattress a medicine? I used to sit down a lot, doctor. Dr. Israel, comment on this quickly again.
This one are just the same thing of waiting we just talk for the waiting I just talked before. Now your doctor already gives you the best treatment he thinks is better for you. As we earlier said, not be every time that you need to take medicine. You know what you see for the x-ray. That's why he said you should buy the medical mattress. And the medical mattress is actually a medicine to you in this point. So what you say you do for the mattress, that's what you should do. You lie flat on the mattress on your back, so that it will help you stretch your back most of the time after you have come back from your daily activity. Also, if you want to sit down for your chair, and most of us, the way we take sit down for our chair, still they cause problem. You must sit in a 90 degree. I don't know how I'll explain this sitting position in a practical way. This thing go for day good, but you need to sit in a 90 degree, and so that you go sit inside your chair and not be outside your chair. You sit inside your chair. And you get one day when one of my patients they complain of this same back pain, say they sit down too much. I told her that now the way when you take the sit down, and in that point I tell her how she go take the sit down. When she sit down for my office there, she was feeling some relief, and she said, doctor, I actually they feel some relief. And they feel say the pain they go down small. So most of the time, the way you sit on your chair can also cause your back pain. So if you sit inside your chair in a way that you'll be sitting in a 90 degree posture, your back pain will at least will be reduced. And as Dr. Fred also talked, you don't need to sit down for a very long time. Sometimes when you sit down reach some time, you also need to stand up, take a walk, stretch your back, then come back and sit again. Then after the day activity, and you see your back they tired, you can go for a massage, and that will help to relieve the muscles. You'll just be fine.
Thank you, Dr. Israel. Hey, we've gone past our normal time. See questions. Can too much standing or too much trekking cause back pain? Yeah, standing for too long can cause you back pain, especially if your back is prone to developing back pain. Do you understand? Standing for too long. We'll go to the next one quickly because of time. For the trekking part, when you say too much trekking, as long as you are standing walking for too long, you need to rest the spine. Remember, your back, it supports you. If you give too much stress, if it gives you pain, and if you rest, the pain will disappear. You rest, massage your back, it's supposed to disappear. Remember, you get acute and chronic pain. There, yes, for this mattress part, I bet make I talk something. Everything no be medicine. If you listen to what Dr. Israel talk, everything no be medicine. So, ladies and gentlemen, I beg, don't be say we believe that my doctor must give me medicine to drink. You know, give me medicine, the doctor knows how to work. No, the doctor has discovered that what you need is not medicine but mattress. So please, let's not work with the mindset that every time we need medicine. Question, oh God. Dr. Israel, this one says, let's spend 5 more minutes. Can low back pain affect my neck and shoulder?
Can low back pain affect my neck and shoulder?
Or let me respond. Let me respond quickly. See, you've already said something.
Okay.
Low back pain. Low back pain. We get low back pain, up back pain. Low back pain at your waist area. That one different. You can have pain at your neck, but not be low back pain be that. Do you understand? People they get pain for their spine. If you get pain for your neck, if you get pain for your lumbar region, if you get pain for your lower back. So if you dey get low back pain, that one are totally different stuff. If you get pain for your neck, na another thing. However, they are all in your spine and they are back pain, upper back and lower back. So low back pain different from pain for the neck. I don't know if you understand, if it makes sense. Okay, Israel.
Yeah, and I think you just give the answer, because when you say low back, it they down, then your neck and your shoulder they up. So except maybe you are having pain.
Okay, Dr. Israel network don't disappear. Sharp, sharp. Let's do this. Doctor, what is the right treatment for a slip disc? I feel so much pain at my lower back to the waist, straight to the knee. So, two questions for you. How you can know say a slip disc? Have you seen an orthopedic surgeon to confirm? Have you done a CT scan? You don't do MRI, they don't confirm. If they confirm, you're going to need to take that result to an orthopedic surgeon or a neurosurgeon. They go look at the extent of the slip disc. If now waiting needs surgery, they go tell you, say, you need to do operation. Do you understand? And if the thing they affect your knee or your leg, then they go need to correct that slip disc first. Maybe now they cause the knee pain. I don't know if it makes sense to you. So if you have a slip disc, the assessment of your slip disc, now a specialist go assess you and go tell you, okay, this thing no, now surgery you need. No, this thing no, now injection you need. I don't know. I'm not a specialist. Thank you. Can also lead to back pain. We just answered this, my dear. You would have to watch again from the beginning. No vex. Sorry. Mine is posture. I do sit down for work for 10 hours. Please, how do I sit smart? There's nothing by sitting smart. You would have to sit and get up, then go back again. Trust me, there is no two way about it. You will keep having the back pain. I know that some of us, they sit down for a long time. Highest, you can get up from your seats for 2 minutes and sit down again. There is no negotiating about this. You know if you change them. If not, the back pain will continue. Yes, you can change your workstation. You can get ergonomic chair. You can adjust your table and your laptop, no problem. But sitting down for 10 hours is a capital no, Jennifer. This one says, can infection cause back pain? We answered this. Yes, we've answered this. Please, you will have to watch the video again from the beginning. They move very fast. I'm moving very fast. I want to shut down. I'm having back pain moving to neck to head. What can we call it? I don't know what to call it. I don't know what to call it. I can't give it any name. I can't make any diagnosis for you. So I can't call it anything. But I know you have pain at your back. What is causing it? I don't know. What name? I can't give it because we know they consult for social media. Sure you get? Yeah. Okay, we are out of time and I have to go. Somebody says, okay, this is the last question here from Uloma. Doctor, sometimes I notice that I used to have a sharp pain on my back. The pain come and last for 5 minutes and vanish. Okay, so find out what you they do where they bring this pain come. You get anything where I go do where they bring them? That's number one. Number two, if the pain come, what you they do where they make the pain go? Pay attention to all these things. 5 minutes, you don't come, you don't go. Very good, thank God. But try do analysis. Where is this pain coming from? Is it my age? Is it the job I do? I've been at stress. I've been at position. I've been at sleep position. I've been on my phone, my mattress. These things are very, very important so that you will feel help yourself. Okay, Frances says, yes, I have done MRI and have been going to the orthopedic hospital for 6 months. They just keep giving me drugs. Oh, so sorry. Okay. What advice you be say? Let me advise you something. When you go back, ask your doctor, what is the definitive treatment? That one means say, waiting be the final treatment. Will I be on this medicine for the rest of my life, or na operation I go do? Make them tell you so that it will help your mind cope. Because I believe, say, maybe you don't know the treatment, you just take medicine, or they don't tell you, you don't understand. So go back, I beg. Doctor, this medicine they give me, now I go to take for the rest of my life, or my back pain, it need operation, or I need exercise or physiotherapy. What exactly do I need? They will tell you. Is that clear? Thank you very much. Okay, so ladies and gentlemen, um, we don't spend more than the normal time where we spend for the live session. And Dr. Israel's network is bad, so I don't think it's coming back again. But even at that, we just need to stop right now because of time. And I want to thank you all for joining. I want to thank those who send stars. I want to thank those who send super chats and super sticker on YouTube. Thank you very much. And if you just they come, you will miss. Please go back and watch the video from the very beginning. Maybe it will help you. This program now every Sunday, 8 p.m. West African time. We know they come late. When it's 8 on the dot, we start. And we've been doing this for the past 3 years. During the week, you can join me during the week when I'm live, and I will try to take your questions. Furthermore, I beg, we know they do private chats on social media. We know they give number on social media. In case you dey here and you want to do inbox chat, I beg, no vex. I'd always apologize. I know they do them. I know they give number out. I know they chat privately. I get very, very personal and professional reasons. So we go beg you, please follow your doctor talk. Here, our goal now to teach you. But if you won't come follow me talk, you must click on the link for my page. There's a link there. Click on the link. Book for consultation. Somebody will follow you chat. They will tell you, make you pay. You go pay for the consultation, and then we go chat. I beg. Now so it be. And now so I do am since on all my social media platforms. God bless you. Thank you once again for coming. Thank you for your understanding. And I don't take your presence here for granted at all. Everybody, thank you. Thank you. God bless you. Wishing you a happy Easter. Like I always talk, good life now waiting. Good life now waiting. Good life now waiting. Oh yeah, tell me. I'm shutting down. This is 11 minutes past the time. I won't go record videos this night. I go record some videos. So tell me, good life now waiting. Oh yeah, let's go. Oh yeah, let's go. Talk to me. Good life na sense. Yes. Good life na sense. Thank you, everybody. God bless you and have a great night. Bye bye.